A hearty good afternoon and welcome to the session on early ovarian aging and effect on reproductive health. We are glad to have Dr. Swati Shree among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Thank you for your kind introduction. So now today I am going to discuss the topic early ovarian aging. It is the topic which is now becoming very much in discussion for many people now. So actually what is early ovarian aging? So the term itself says early means before the time. Ovarian is related to ovaries and aging is like the it is becoming more aged. That means the reserve, the follicles are getting less. What we see is that the aging process. So for ovaries, the aging process, what is the aging process for ovaries? So when the follicles start getting used up and with time, as woman ages, the number of the follicles goes down. So there will be less number of the follicles. So first of all, follicles I want to clear again. The follicles are the small fluid filled bubbles inside the ovaries which contain the eggs. So these, from the beginning, when I see that whenever any woman is girl is born, they are born with certain fixed number of the eggs. These are very high in the number, and this is when they are born. And after that, there is no addition of these eggs. So once a girl attains the puberty, every month she forms some eggs. One egg out of that gets released, and if it is there is no pregnancy, that gets destroyed and the girl has the periods. With time, these numbers, these eggs are as the eggs are getting used up, the number goes down. So this is the number of the eggs in the ovary at some one time. At one time, what we see, like if I am seeing for any woman and today. So at today's time, at one time when we see it is called the reserve of the ovary. So as the aging continues, like as a woman ages or as a girl goes towards the further age, these eggs are continuously becoming used and destroyed. So the number of the follicles or eggs will go down. So this is called ovarian aging. So generally, it has been seen that the egg reserve is at appropriate level till the age of the 35, and after the 35, they start little going down. Especially even after the age of the 37 years, this reserve, this egg reserve is there, which is there in the ovary. They start going down at a little rapid rate. So it is there is accelerated rate of decline in the fertility, or we can say accelerated rate of the loss of the follicles at the age of 37. Because it has been seen that the normal age of menopause is from 45 to 55 years of age. So there is the loss is at increased rate, and around the menopause, by the menopause, a woman does not is not left with any of the egg reserve. The egg reserves are not there. Eggs will stop growing, and then woman does not get periods, and that marks the end of the reproductive age of a woman. So this is what happens naturally. So early, what does early means? So early means when this process of rapid decline in the fertility or rapid decline in the number of the eggs happens in the mid of the 30s of the age group. Generally in the 30s, we should not find that. In the mid of the 30s, in early 30s, if we find the rapid decline, it is called early ovarian aging. And now because of the we are seeing more and more women nowadays in our, especially in the fertility, out of the see, if there is 100 infertile women in an OPD, if we see 100 women, around 20%, around 20 women out of the 100 women have this condition called early ovarian aging. So how do they represent? So mostly they may not be having any issues, they will be having regular cycles, but when we see the when they are trying to conceive, they find it difficult to conceive. Many a times, it having the early ovarian aging does not mean that woman will not conceive. Only thing is that the reserve is less. So when we how we find the early ovarian aging is that when they are coming to for the treatment of the fertility, when we do the scan and do the blood test to check for the egg reserve, that is the egg count, whatever is there. So the test scan, when we see the ultrasound and we find the see the number of the eggs remaining at one point of time, it will be low in these women. which is generally seen in women after the age of 35 or 37. So if we find this type of changes, and also the blood test called AMH, which is one of the marker for the egg reserve, it will be also low. So these markers, which should be seen in an age group of around more than 37 years of age, if we find these changes before this age group, in the woman with a little younger age, it is called early ovarian aging. So now coming to what its impact is. So our early ovarian aging woman might not have any symptom, and she might have regular periods. She might get pregnant and have a normal pregnancy also. But some women with early ovarian aging may struggle with fertility, may find it difficult to conceive. So the reproductive impact on this is that they have the less reserve when the egg count is less. What we see is like for the treatment we have to since they are at less age, so we have to go forward to the little faster in giving them the test treatments for the fertility. So, and they might need, we might need to give them stimulation to grow the more eggs. We might need to go for the IUI, in which we inject the host partner's semen inside the woman, or we may offer them the treatment of IVF. So, general criteria like for the IVF is what we have to do is that we have to wait for 1 year of for a couple to try themselves if there is having no issues. But if we find that the egg reserve is less, then it becomes one of the issues. So, in that condition, we may advise a woman for IVF. So, depending upon the egg reserve, the IVF may be offered as to those women. So, but there are some differences in the treatment of these women as compared to the same blood test reports of a woman with a higher age. So suppose a woman with a young age woman is having the early ovarian aging, her AMH is low, her and follicle count is low. The same thing if I see in another woman who is around 40 years of age and is also having the same AMH and same follicular count, that is the egg reserve. So if we see and if we give the treatment, it has been found that the women who are at younger age group, they conceive or they respond the treatment much better than as compared to the older woman. So that means actually in those women the eggs have not got that much of the time to have that DNA damage, which happens because of the some oxidative reactions and some of the toxins and pollutants. Those all are lifestyle dependent. So as a woman ages, this the egg quality also becomes worse. So which is being seen in the woman with less younger age group, that egg quality is better. And if we give offer them any treatment, they respond better. And if they are going for IVF, the egg quality in the IVF, when we take out the eggs in the process of the IVF, we find it to be of better quality. They will have better fertilization rate, and their success rate is also higher in those women. So this is the most important impact on the reproductive health of a woman. So women with early ovarian aging may have little less fertility. If we find any woman with the features of early ovarian aging, that we have any reports which suggest early ovarian aging, in that woman it is better to go ahead and do an enhanced treatment, and because there are chances that they will have a better success than the older woman. So it gives them a window of opportunity, because if we delay further, that if they have started early ovarian aging, a time might come then they might not be responding much, and they might not be responding better. So in this so we can say that in early ovarian aging, we have to give them a better chance. It is the time that they can have a better chance. And it is also an opportunity to educate them, because if they have early ovarian aging, they may go for menopause a little early. So that can be one of the impact, that they can have the early menopause, because since the egg count has started declining at a accelerated rate in a lower age group, so they may have the menopause a little earlier. And since menopause has lots of impact on a woman's health, like they have impact on the bone health, they have impact on the heart. So and the moods and mental health is also impacted. So we can support a woman from beforehand. We can prepare them, because still, if we they have chance, not asking that they need any treatment, but definitely lifestyle changes from the beforehand, they can prepare themselves to go through the transition very smoothly. So lifestyle changes is first management in any condition, because all the conditions whatever we are getting nowadays is all because of the changing lifestyle. What we used to be earlier, we are not the same with now. We have changed our fooding, our living, our surroundings, our environment, pollution, everything has changed. So I will say that it is recommended to always promote these women to go for a better exercise, have a healthy diet, so that they can have a smooth transition and they do not have any effects of these early menopause. Now the next thing which I want to discuss, there is one more condition which is called premature ovarian insufficiency or premature menopause. So when I speak about early ovarian aging, it is not the same as the premature menopause. So in premature menopause, the egg count is like the eggs reserve goes down suddenly, and it becomes similar to the menopause. And they find it difficult to conceive. Whereas in in early ovarian aging, the count is still there. They still have the periods and they still can conceive. Whereas in premature menopause, the account is since the account is less, we cannot offer them any treatment for that. Just one second. So for premature menopause, the treatment is totally different. We have a totally different setup, and we they have then other management, and in those women only 3% can conceive spontaneously. So premature menopause and early ovarian aging is totally a different entity. Early ovarian aging we only see in the young women when they have everything, they have regular cycles, they don't have any issues, but they have the when we are doing the tests for the pregnancy issues, for fertility issues, when we find that they have the less reserve, which should have been found in those women who are more than 37 years of age. So that is an issue which is there in early ovarian aging, but these women generally respond to very well to the treatments. So if any woman is found with that, I will advise them to go ahead with the treatment as advised with your doctor, because still it's just a marker of the blood test and the scan which has come shown that you have the reserve is less, but still you can respond better to the treatment. And for pregnancy to happen, one egg and one sperm is required. So looking at these parameters and looking, we have a better outcome for these women. So we'll always advise to go for the treatment. Lifestyle changes will be definitely will be there, that has to be done. And if there are any other factors, like if any infection or some other conditions are there, or underlying cyst is there, those treatment can also be done as advised by your doctor. So when it is any early ovarian aging is being found, we have to look for the some of the factors which is causing that if it is there, we can remove those factors, and then we can go ahead. So at the end, in my conclusion, I will say that early ovarian aging is a condition in which the egg reserve egg count is less at a younger age, which can be because of the multiple factors like genetic factors and the environment, endometriosis, and cysts. Smoking is one of the important factors. Any drugs which you are taking, any cancer treatment with chemotherapy and radiotherapy, any other medical conditions which are autoimmune and disorders, like in which the own body's defense mechanism goes against the own. These are the multifactorial factors. If there are any of the factors, try to remove those factors, work upon your lifestyle, go ahead with the treatment, because you still have the hope. Go ahead with the treatment, the success rate are good. So this is what I just want to tell about the early ovarian aging and its impact on reproductive health, and not only the reproductive health, it has impact on other aspects of your health which in the long term. So please do take care. Thank you.